Later this year, NEA Baptist Health System will open its new $400 million campus, which will include a 550,000 square foot NEA Baptist Hospital and 212,000 square foot NEA Baptist Clinic, all under one roof. The 80-acre medical campus will also house the new Center for Cancer Care, which will have state-of-the-art and complete cancer care for patients all in one location. The new hospital will house larger patient rooms and operating suites, and the new clinic will be housed in a massive amount of space. There will also be the latest state-of-the-art equipment and new services offered. Hundreds of jobs are expected to be added as officials get ready for the new hospital to open. One big question related to the new hospital and clinic is how will NEA Baptist transition from the current buildings to the new building on Highway 49? Scott Childers is the Director of Transition at NEA Baptist. He says meetings involving numerous committees have been discussing the transition for the past year.
We've been working on transition for over a year now. It's a huge task, as you might imagine, to occupy a 550,000 square foot hospital and a 225,000 square foot clinic space, and then a 35,000 foot comprehensive cancer center. So we've been planning every aspect of that, from paper clips to MRIs and CT scanners. We have broken up our task into components and have committees that are working on specific aspects of that. The biggest one that's coming up initially is our building load challenge, and that is the task of physically moving in all of the pieces of equipment, supplies, materials into the building to be ready for our occupation of the building.
Childers tells how NEA Baptist will start moving into their new building.
Well, we're fortunate in that we have a good contracting partner in Hoare Construction who has agreed to allow us to be moving into the building in phases. So as they are completing sections of the building, we'll be working hand in hand with them to occupy pieces of the building as it becomes available. So we've been working with the State Health Department, who has approved that approach, and then we'll be working to occupy and do what we can in those areas to get things installed and begin some training in those areas that helps us to otherwise decompress all the activities that we would otherwise have to do if the entire building was turned over to us at one time.
He tells what the first areas are that will be ready first.
The first areas that we're going to be moving into are the loading dock and the materials management areas, those areas that are in close proximity to the loading dock. It's important for us to get that piece of the building first, because we'll have literally thousands of tractor trailers coming in here delivering our stuff and getting it processed and into the building where it needs to be. So we need to have access to the loading dock is the first place that we got to get control of.
Childers tells about the different aspects that have been planned.
The Patient Move Committee is responsible for planning how we get our patients from our current campus into the new campus. So there is a very detailed plan that will be rehearsed and vetted and put into place, and we will ensure that our patients are moved in a safe, timely, and efficient manner that will not compromise their care, and there is a ton of work that goes into that. We have several other committees. We have a training committee. As I mentioned, a lot of our equipment will be new, and so we want to make sure that people have the training and knowledge and are efficient at operating that equipment before we get our patients over here. So we will be redesigning all the patient care processes to meet and be able to operate in from our current facility into the new hospital. And we are hiring a little over 400 additional staff in order to be able to man this facility. So we'll be taking a lot of those staff, bringing them over here and doing dress rehearsals for every one of our patient care processes before the patient move. So we have to design and outline every step of every patient care process that will happen in this new campus. And then we're going to bring staff over here and walk through all of those after we train everybody to ensure that when patients get here, we're ready to provide the highest quality of care that we can.
One important aspect that is taking some special planning is transporting patients from the old facility to the new one on Highway 49. Childers tells how transporting patients will take place.
The patients, when we move them, we plan to move all of our patients in one day. Traffic is a concern for us, so we'll do that early in the morning on a weekend probably. We plan to move all of our patients one day. We've contracted with both ambulance companies in town, and we'll be utilizing their services. We will open our emergency department on that same morning and let the community know when that day will be and what time that will be. Our license to operate as a hospital will transfer that morning, and we'll be operating from this facility. At the same time, we'll be turning the light off at the emergency room at our other facility and ramping down services there. So this facility will be turned on at the same time that one gets turned off. We know that there will probably be some stragglers that don't get information, or some people traveling through, or something that will show up there. So we'll be able to take care of those people's needs if they show up. But our primary mission that day will be here at our new campus.
Childers says there will be extensive training for staff before they go into the new building, and then more training once the staff gets into the new building. Childers acknowledges the transition is a complex issue and says many more meetings will take place to get ready for the official move later this year.